Bias in care is an often overlooked but significant factor that impacts the quality of support provided to individuals with developmental disabilities. Bias can be conscious or unconscious, and it shapes the way direct care staff interact with the people they support. Recognizing bias is essential because it influences decision-making, affects the level of empathy shown, and can create disparities in care. Whether bias is based on an individual's abilities, communication style, behavior, cultural background, or even personal hygiene, it can lead to unintended discrimination. When direct care professionals become aware of their biases, they take an essential first step toward providing fair, respectful, and person-centered support. One of the most common forms of bias in care is ability bias, where caregivers unintentionally underestimate or overestimate a person's abilities based on their diagnosis. For example, a staff member might assume that a person with a developmental disability cannot understand complex information and therefore avoid engaging them in meaningful discussions. Conversely, a person who is highly verbal may be assumed to have stronger cognitive abilities than they actually do, leading to frustration when they struggle with tasks. Recognizing these biases allows caregivers to support individuals based on their actual needs and abilities rather than assumptions tied to a diagnosis. Another common bias involves behavior and communication styles. Direct care staff may respond differently to individuals based on how they express themselves. A person who is quiet or nonverbal might receive less attention than someone who is expressive and engaging. Similarly, behaviors that are considered difficult or challenging may lead to negative assumptions about an individual's personality, rather than recognizing that these behaviors often communicate unmet needs. Caregivers must challenge themselves to look beyond initial impressions and understand what each person is trying to communicate, ensuring that everyone receives equal care and attention. Cultural bias is another area that can influence care. People with developmental disabilities come from diverse racial, ethnic, religious, and linguistic backgrounds, all of which shape their values, preferences, and ways of interacting. If a direct care professional unconsciously favors individuals whose cultural norms align with their own, others may feel excluded or misunderstood. This can lead to frustration, withdrawal, or even behavioral challenges that could have been avoided with culturally responsive care. Taking the time to learn about a person's cultural background and respecting their traditions fosters a more inclusive and supportive environment. Personal biases about age, gender, and appearance can also affect the quality of care. A caregiver might expect more independence from a younger adult while being overly protective of an older individual, even if both have similar abilities. Gender bias can manifest in assumptions about what activities or skills are appropriate for men versus women, limiting opportunities for individuals to explore interests freely. Appearance-based biases can also come into play, where individuals who present as more put together might be treated with more patience and respect than those who struggle with hygiene or dress differently. Recognizing these biases ensures that care is provided equitably and based on individual needs rather than surface-level judgments. Unconscious bias is particularly challenging because it operates beneath awareness, influencing decisions without caregivers realizing it. This is why self-reflection and training are critical. Direct care professionals should make a habit of questioning their assumptions about the individuals they support. One way to do this is by asking, would I react the same way if this were a different person exhibiting the same behavior? Or am I making this decision based on the person's actual needs, or am I influenced by my own perceptions? Engaging in discussions with colleagues, participating in training sessions, and seeking feedback from individuals receiving care can help uncover hidden biases. Supervisors and organizations also have a role in mitigating bias in care, providing ongoing education about bias, encouraging open conversations, and fostering a workplace culture that prioritizes self-awareness and respect can make a significant difference. Care agencies should implement policies that emphasize individualized, person-centered care, while also addressing systemic issues that contribute to biased decision-making. ensuring diversity among staff, offering language support services, and creating structured feedback mechanisms can all contribute to a more equitable caregiving environment. Recognizing bias is not about placing blame. It is about creating awareness and striving to provide the best possible support to individuals with developmental disabilities. Caregiving should always be guided by empathy, respect, and a commitment to understanding each person as an individual. By actively working to identify and challenge biases, direct care professionals ensure that every person they support is treated with dignity and given the opportunity to thrive,